Hi, everyone. My name is Caitlin Duffner. I'm currently a third year physical therapy student at The Ohio State University, go Bucks. I'm doing my final capstone experience at University of Illinois, working with athletes in adaptive sports like wheelchair basketball and wheelchair racing. As part of my capstone, I created a six-part PowerPoint series about adaptive sports, and it's called Bridging the Gap Between Physical Therapy and Adaptive Sports. There isn't really a clear relationship between PT and adaptive sports like there is with typical sports. So the purpose of this series was to try to bridge that gap by providing physical therapists and physical therapy students with an introduction to adaptive sports so we can then better treat the wheelchair athlete and kind of understand the connection between PT and adaptive sports. The scope of this series encompasses wheelchair basketball and push rim racing. The components include the benefits of adaptive sports, classification, rules, biomechanics, common injury, prevention, outcome measures, and then a case study at the end. And all those components are spread out over 6 PowerPoint presentations. So the objectives of this part, or part one, are to review who qualifies for adaptive sports, to learn how to get your patient involved, to review the benefits of adaptive sports, and to learn strategies for bridging the gap. So as far as who qualifies for adaptive sports, the ADA definition is a person with a physical or mental impairment that substantially limits one or more major life activities. So this can follow a large range of impairments and diagnoses. Some of the ones listed on the screen are impaired muscle power, impaired passive range of motion, limb deficiency, leg length difference, short stature, hypertonia, ataxia, athetosis, vision impairment, and intellectual impairment. And so neuro and peds PTs work with this population 24/7. And I think that there's a lost opportunity for referral here. I think that adaptive sports are really important, and they can also help you connect with the community. And I feel like PTs don't really do a good job of advocating for this community, and we could do a little bit better job of that. So you can get your patient involved a number of different ways. The first way is knowing their goals and preferences. If they like outdoor rec sports, performing arts, if they're more of a team sport or individual sport person, and what their goals are. If their goals for sports are trying to meet friends, if they want to compete and they're just a very competitive human, then some sports might be better than others, or if they just want to stay in shape. I think it's important for PTs, especially neuro and pediatric physical therapists, to have a wide knowledge of adaptive sports and a wealth of resources to try and connect their athletes to maybe local organizations, and really advocating for your patient that they should consider participating in adaptive sports because there are so many benefits, which we'll talk about later. So some examples are tennis. This picture here is quad rugby, or some people call it murder ball. We've got curling, sled hockey. Down here, we've got a kid on a paddle board. This cute little girl in her ballerina costume. This guy's doing archery. And then over here, we have surfing, and I think that's a monoski is what it looks like. So there's a lot of different options. You don't have to be super competitive in your sport. If you just want to get out there and kayak, that's awesome. And it's a great way to meet new people. So with adaptive sports, there's something called classification. So all athletes, especially in competitive sports, are given a class, and that class is based on your ability. Different classes help maintain fair play. So in racing, you're competing of athletes in the same class, so you're competing of athletes with similar abilities to you to try to keep everything fair. We want the competition to outcome to depend on talent and not someone's ability or disability. So your classification can depend on upper extremity function, lower extremity function, ability, and they're different for each sport. That's not like you get classified one time and then every sport applies to that. We'll get into the specific classifications for each sport in other PowerPoints, but they're going to be different for every sport. And then in order to be a classifier, anyone who passes the course can classify. It does not have to be a PT. You can be a coach. You can just be really interested in adaptive sports. You don't have to be a physical therapist. So why is this important to physical therapists? I think that it's important to understand the demands of your patient's sport in order to properly treat them. So if any of the people on the wheelchair basketball team have like an orthopedic injury or end up needing surgery or X, Y, and Z, I think it's important to understand the demands of the sport like you would with typical sports. Like in PT school, we have lectures specifically on basketball and typical injuries in baseball and things like that, but we don't really have specifically lectures for adaptive sports. And I think that that's kind of lacking in our knowledge. So that's like one of the main reasons I decided to make this series. I kind of talked about it a little bit before, but neuro and peds PTs work with patients with disabilities like 24/7. That's your entire caseload. And I think that that's a great opportunity for advocacy that we're kind of missing as like a PT community. And patients might not know how to break into the adaptive sports community or the fact that adaptive sports even exist. A lot of the interviews that I did with athletes and coaches at U of I were introduced at just like happenstance. They were just in the right place at the right time, and somebody's mom came up to them and was like, "Hey, you should try wheelchair basketball." And then they fell in love with it, but they could have fallen in love with it years earlier and had that community if maybe their PT would have suggested it. So there's also a lack of awareness aspect that I think we need to address. There could also be clarity for athletes who are injured. Sometimes athletes with congenital disabilities don't know if they're supposed to go to their peds PT, or you're supposed to go to a sports PT or maybe a neuro PT after you get an injury. It's kind of like a no man's land, for lack of a better term, on where they're supposed to go after an injury. So I think we can think a little bit more about that and have a specific place for athletes to go if they do have an injury. So I put together a few like interview highlights. So it's very casual. I was just pestering athletes when they were lifting and kind of asking them some questions, and I compiled a few of them together into a video because I think it's better to hear about it coming from them rather than me. So we'll check this out. I try not to make it too long.
Hi, my name is Gabe Denbraber. I go to the University of Illinois. I'm on the men's wheelchair basketball team. I've been playing here for 3 years now, going into my fourth. Wheelchair basketball is the community aspect of it. Is when you come here, you have a family and you feel like you are with other athletes, and you have that sense of, okay, I'm not the only one that has a disability that can be an athlete. There's other people who I can compete with, and that goes for the rest of the college division, where you get to see high-level athletes competing against each other every tournament, and it's a lot of fun to just be able to go there and meet new people and figure out their story too.
Hi Josh, what's your name?
I'm Josh Joyens.
Nice.
Yes.
How long have you been playing basketball?
For 8 years.
For 8 years.
Mm-hmm.
Do you have a scholarship on the team that you're currently on?
I do not, but I have a scholarship through an organization called the Nielsen Foundation.
Nice. What team are you currently playing for?
The wheelchair basketball team.
Gotcha. And you said you've been playing for 9 years?
Yeah.
What's it like starting at such a young age? Do you think that you have an advantage over other people, or do you think that not so much?
I think I have an advantage starting over people, but I started later than most people. I didn't start till the 7th grade.
Oh, okay.
And part of that is because I'm ambulatory and didn't know about adaptive athletics. So I think I'm at a disadvantage to some people who started earlier than I did. But yeah, the earlier you start, the better.
Got you. What's your favorite thing about playing wheelchair basketball?
The camaraderie with my teammates and with the people in our league. I just love traveling and being around such great people.
That was very wholesome. What's your favorite breakfast meat?
My favorite breakfast is bacon. Gotta be.
That's valid.
Yeah, Waffle House bacon too.
I can respect it.
Yeah.
Oh, that's very specific.
Yeah.
I'll take it. Hi, Abby. How's your day going?
Wonderful.
What's your favorite part about adaptive sports?
The community. I love everybody in the disabled sports world. It's a lot of fun.
That's so cute. How's your lift?
So much fun.
How long have you been playing?
Since 8th grade, so about 8-9 years.
Sick. How much do you bench?
This is 105. Not a max though.
Nice. All right, Brian, what's your name?
Brian.
Perfect. How long have you been racing?
16 years.
16 years. Oh, that's a long time. So when did you start? What age?
15.
Did most people that you know start that young, or
No,
was that
everyone.
kind of older?
I was older.
Okay. How do you think that changed your participation in track?
I wanted to catch up to everyone, so I worked harder.
Got you. Okay. Who are you racing for currently?
University of Illinois and Team USA.
Nice. That's impressive.
Thank you.
How did you find out about adaptive sports?
My then high school track coach came up to me on the first day of high school and asked if I could walk or if I had a broken leg. When I told him I was in the chair permanently, he said, "Do you want to try the track team?" And I said, "Sure."
Got you. Sweet. That's awesome. Okay, Brian, last question. What is your favorite thing about adaptive sports?
That it gives me an opportunity to work out every day and feel good about myself.
Great answer. So a lot of what you see there are athletes talking about the community and talking about how adaptive sports keeps them in shape and gives them like a greater sense of self. And I think that those two things are super important across the board. Even like interviews that I didn't video, a lot of the answers were the same, which they were like talking about how awesome the community is and how they kind of like found their people. And so I think that that's really important, like socially. So the psychological benefit based on the research is there's a higher satisfaction with life, positive impact on body image, positive association with employment, improved community integration and quality of life, and improvements in depression and anxiety. So there's a lot of benefits there. I also found this study by Shapiro et al. That found that parents of children with disabilities who participate in adaptive sports actually rate their child's quality of life significantly lower than the child does. So that was really interesting to me to really see the parents' like lack of knowledge of benefit of adaptive sports and how that might become a barrier, especially in the pediatric community. And you need to get the parents on board as much as you need to get the child on board in order to really have them see that benefit and then maybe keep their kid in sports because they really understand that benefit. So there's also physiological benefits of adaptive sports. Those include improved cardiovascular function, reduced deconditioning, improved upper extremity function, and improved balance. I think that there's something that PTs really haven't tapped into, and the importance of sports and how they can affect function. And that's something that I think that we should be thinking about and maybe incorporating more into rehab, especially for competitive individuals in rehab. So cardiopulmonary benefits include forced vital capacity and forced expiratory volume of 15 male tetraplegic subjects significantly increased a year after wheelchair rugby. And then 17 men with spinal cord injuries who engaged with sport activities over 5 years had significantly decreased overall carotid thickness in diameter. And then there's also benefits with movement function. So one study showed that 6 weeks of sitting boxing resulted in significantly greater manual function test scores of 26 stroke patients, and 7 weeks of a group volleyball program improved measures of upper limb function in 48 stroke patients. So I think that sense of community and having a little bit of a competitive edge and doing something fun is going to be motivating for individuals to come out and continue to participate while also improving cardiopulmonary and movement function. Another physiological benefit is balance. So one study showed that balance significantly improved following golf, dance, horse riding, sitting boxing, or kickboxing among 242 participants with stroke or MS. I think that one's really interesting because it has such a wide range of activities, and all of those activities showed significant improvements in balance. So it doesn't really matter the activity that you're doing, at least according to this study, but you're still going to get some benefits from participating in sport, kind of no matter what that sport is. And then another study showed that para and tetraplegic individuals in a 4-month swimming intervention improved their functional independent measures score by 7.75 points. So that's a pretty significant leap. And it just goes to show how much benefit that there is in adaptive sports. So how can we as physical therapists bridge the gap? I think the first thing that we can do is educate and introduce our patients early to adaptive sports. Even in like the acute and inpatient settings, if you know that someone might be in a wheelchair, you can suggest specific wheelchair sports or try to get them involved in something with other people who have similar disabilities to try to find a sense of community. Especially in peds and neuro PTs, I think there's a missed opportunity to connect patients to adaptive sports organizations. Another thing you can do is to provide resources and connections for local leagues. Really try to do the work and do a quick Google about local adaptive sports and try to get them involved in any way you can. The other thing that you can do is incorporate sports activity into rehab. A lot of people are more competitive than you think they are, and they're willing to work hard. And I think that we can really tap into that as physical therapists. Some more things we can do are learning how to treat upper extremity injury in wheelchair athletes. And that's kind of my role here today. All of my PowerPoints are gonna show the demands of wheelchair sports and common injuries that occur in that sport. And I think that really understanding the sport is important to treating the impairments and to doing a proper return to sport. Another thing you can do is volunteer, really just get involved, make connections so that you can better educate and refer your patients to community leagues. The last one is to become a classifier, like we talked about a little bit before. So those are the people that are assessing the athlete and then giving them a class based on their ability. So here are some resources. This first one at the top is how to become a wheelchair basketball classifier. So you can go to the nwba.org and you just have to sign up for classes, go to the classes, pass the test, and then be a classifier. The other three are local adaptive sports leagues. So you can search them by state. There's also like a Great Lakes region, which is just relevant because that's where I'm from. And then there's Move United, which is a specific brand, a specific company that does adaptive sports. And if you click on that link, they'll give you all the sports and then links to every individual sport. So that's a pretty good resource as well. And then here are my references. And then this is the first part of the series. The next part, we will be diving into wheelchair basketball, just an introduction of classification, and kind of just introduce everybody to the sport. And then we'll go on to biomechanics from there.